Module 3, Emergency Procedures. Question 1. You will find out about emergency assembly points from A. A risk assessment, B. A method statement, C. The site induction, D. The permit to work. Answer C. The site induction. Question 2. How should you be informed about what to do in an emergency? Give 2 answers. A. From the site induction. B. Look in the health and safety file. C. Ask the health and safety executive, HSE. D. Ask the local hospital. E. From the site notice boards. Answer A and E, from the site induction and from the site notice boards. Question 3. A first aid box should not contain A. Bandages, B. Plasters, C. Safety pins, D. Over-the-counter medicines such as aspirin or painkillers. Answer D. Over-the-counter medicines such as aspirin or painkillers. Question 4. The first aid box on site is always empty. What should you do? A. Bring your own first aid supplies into work. B. Find out who is taking all the first aid supplies. C. Find out who looks after the first aid box and let them know. D. Ignore the problem, it is always the same. Answer C. Find out who looks after the first aid box and let them know. Question 5. Does your employer have to provide a first aid box? A. Yes, every site must have one. B. Only if more than 50 people work on site. C. Only if more than 25 people work on site. D. No, there is no legal duty to provide one. Answer A. Yes, every site must have one. Question 6. When would you expect eyewash bottles to be provided? A. Only on demolition sites where asbestos has to be removed. B. Only on sites where refurbishment is being carried out. C. On all sites where people could get something in their eyes. D. On all sites where showers are needed. Answer C. On all sites where people could get something in their eyes. Question 7. If you want to be a first aider, you should A. Watch a first aider treating people, then try it yourself. B. Ask if you can do a first aider's course. C. Buy a book on first aid and start treating people. D. Speak to your doctor about it. Answer B. Ask if you can do a first aider's course. Question 8. What is the first thing you should do if you find an injured person? A. Tell your supervisor. B. Check that you are not in any danger before you check the injured person. C. Move the injured person to a safe place. D. Ask the injured person what happened. Answer B. Check that you are not in any danger before you check the injured person. Question 9. If someone falls and is knocked unconscious, you should first A. Turn them over so they are lying on their back. B. Send for medical help. C. Slap their face to wake them up. D. Give mouth-to-mouth resuscitation. Answer B. Send for medical help. Question 10. Someone has fallen from height and has no feeling in their legs. You should A. Roll them onto their back and keep their legs straight. B. Roll them onto their side and bend their legs. C. Ensure they stay still and don't move them until medical help arrives. D. Raise their legs to see if any feeling comes back. Answer C. Ensure they stay still and don't move them until medical help arrives. Question 11. Someone working in a deep manhole has collapsed. What is the first thing you should do? A. Get someone to lower you into the manhole on a rope. B. Climb into the manhole and give mouth-to-mouth resuscitation. C. Go and tell your supervisor. D. Shout and raise the alarm as a trained rescue team will be needed. Answer D. Shout and raise the alarm as a trained rescue team will be needed. Question 12. If there is an emergency while you're on site, you should first A. Leave the site and go home. B. Phone home. C. Follow the site emergency procedure. D. Phone the Health and Safety Executive, HSE. Answer C. Follow the site emergency procedure. Question 13. If someone is in contact with a live cable, the best thing you can do is A. Phone the electricity company. B. Dial 999 and ask for an ambulance. C. Switch off the power and call for help. D. Pull them away from the cable. Answer C. Switch off the power and call for help. Question 14. What does this sign mean? A. Safety glasses cleaning station. B. Emergency eyewash station. C. Warning, risk of splashing. D. Wear eye protection. Answer B. Emergency eyewash station. Question 15. What does this sign mean? A. First aid. B. Safe to cross. C. No waiting. D. Medicine box. Answer A. First aid. Question 16. If you cut your finger and it won't stop bleeding, you should A. Wrap something around it and carry on working. B. Tell your workmates. C. Wash it clean, then carry on working. D. Find a first aider or get other medical help. Answer D. Find a first aider or get other medical help. Question 17. What is the one thing a first aider cannot do for you? A. Give mouth-to-mouth resuscitation. B. Stop any bleeding. C. Give you medicines without authorization. D. Treat you if you are unconscious. Answer C. Give you medicines without authorization. Question 18. If you think someone has a broken leg, you should A. Lie them on their side in the recovery position. B. Use your belt to strap their legs together. C. Send for the first aider or get other help. D. Lie them on their back. Answer C. Send for the first aider or get other help. Question 19. If someone gets some grit in their eye, the best thing you can do is A. Hold the eye open and wipe it with clean tissue paper. B. Ask them to rub the eye until it starts to water. C. Tell them to blink a couple of times. D. Hold the eye open and flush it with sterilized water or Eyewash. Answer D. Hold the eye open and flush it with sterilized water or Eyewash. Question 20. Someone gets a large splinter in their hand. It is deep under the skin and it hurts. What should you do? A. Use something sharp to dig it out. B. Make sure they get first aid. C. Tell them to ignore it and let the splinter come out on its own. D. Try to squeeze out the splinter with your thumbs. Answer B. Make sure they get first aid. Question 21. Someone collapses with stomach pain and there is no first aider on site. What should you do first? A. Get them to sit down. B. Get someone to call the emergency services. C. Get them to lie down in the recovery position. D. Give them some painkillers. Answer B. Get someone to call the emergency services. Question 22. Someone has got a nail in their foot. You are not a first aider. You must not pull out the nail because A. You will let air and bacteria get into the wound. B. The nail is helping to reduce the bleeding. C. It will prove that the casualty was not wearing safety boots. D. The nail is helping to keep their boot on. Answer B. The nail is helping to reduce the bleeding. Question 23. If someone burns their hand, the best thing you can do is A. Put the hand into cold water or under a cold running tap. B. Tell them to carry on working to exercise the hand. C. Rub barrier cream or Vaseline into the burn. D. Wrap your handkerchief around the burn. Answer A. Put the hand into cold water or under a cold running tap. Question 24. It is your first day on site. You find that there is nowhere to wash your hands. What should you do? A. Wait until you get home, then wash them. B. Go to a local cafe or pub and use the wash basin in their toilet. C. Speak to your supervisor about the problem. D. Bring your own bottle of water the next day. Answer. C. Speak to your supervisor about the problem. Question 25. What is the main reason for having a trained first aider on site? A. To give painkillers without a doctor. B. To provide immediate help for injuries or illness. C. To write risk assessments. D. To clean the first aid box. Answer. B. To provide immediate help for injuries or illness. That's Module 3 complete. Comment your score below and stay watching for Module 4, Health, Hygiene and Welfare. Also, visit wardtraining.co.uk to get your Level 1 Health and Safety qualification needed for the CSCS Green Card application.